It has started. Let's go there now live.
Morning and thank you, Chair. Present is Dr. Dlomo, Ms. Geller, Mr. Sokacha, Dr. Jacobs, Ms. Kwahube, Ms. Wilson, Ms. Ishmael, Dr. Tembe Kwayo, Ms. Chirwa, Ms. Hlengwa, Mr. Van Staden, Mr. Sukers, and Mr. Imam Sheikh. I've received an apology from the Deputy Minister's office. He won't be able to attend the meeting because he's attending another meeting on COVID. Another apology is from the Western Cape MEC. He's requesting to be released at 11:30 because she has to attend to other engagements. The MEC for Eastern Cape is not well and therefore will not be able to attend the meeting. Thank you, Chair.
She is Miss Sukars, not Mr. But then number two, honorable members, I hope you agree with me. We are going to get a presentation from the Minister with regards to the status of COVID-19 in the country and the vaccine update. I've taken it to myself, but I communicated with you that we'll invite 4 MECs so that if there are specific issues around those 4 provinces, maybe the MECs will be there to assist the minister if they are specific, but the minister is also equally competent to deal with those. We were not going to invite all 9 MECs because the meeting might end up this evening, and therefore, if honorable members were to have a specific issue with the issues of the Northern Cape, the Eastern Cape, now we know there's an apology, Western Cape finishing at 11:30, and KwaZulu-Natal, those MECs are part of the meeting today. May I then get Mr. Khatla to indicate the leadership that is leading him from the ministry?
Good morning, Honorable Chair. Honorable Chair, the Minister is available, leading the delegation from the department. Dr. Anban Pillay, I've been advised by the DG that Dr. Anban Pillay will do the presentation, but the Minister is the Honorable Chair. Thank you.
Okay. Thank you very much. Welcome, Minister. I always use you, Mr. Khatla, because I always know that you are present. Sometimes you come in and say, apology for my minister is joining in 2 minutes' time. But thanks that the minister has also joined us. We've noted the apology of the deputy minister and those officials that are accompanying the minister. Honorable members, we are now on item number 5. This is our first meeting after the untimely, very painful experience of losing one of our members in this committee, Honorable Dr. Phumza Janti. I don't know how many of you would probably know that the last time there was a cluster of ministers on social services in Parliament answering questions, Honorable Janji was actually asking a follow-up question from the hospital bed. I'm aware this from the leadership of the ANC because they were asking her if she would say, no. I will excuse myself from the issues from being in the hospital and ask a question. That is how dedicated and wanted to be part of us right until the end. Little did we know that a few days later she would pass on. I've added this item because there has been condolences sent by the ruling party, by Parliament to her family, but I just thought maybe we would also say in the first meeting of the Portfolio Committee after she's no more with us, her seat is empty. We would want to send a condolence message also as a Portfolio Committee to her family for her wonderful contribution that she made while she was with us. If that is actually then confirmed, I would hear members agreeing to that item maybe during the presentations to add that, yes, indeed, we would want to support a message of condolence to that family that that had donated and given us honorable. Thanks. Honorable members, may I then take you, if that is agreed and members will comment, may I take you through another letter, a correspondence from the House Chair that was forwarded to me, and I was asked Ms. Machalamba to flight it there if she's able to. Ms. Machalamba, are you able to flight that one? Okay, so long, let me start reading this one. If it does not come through there, we might get it. This is the letter written to the House Chair, which then he has shared with me, Mr. Frolick. The letter comes from the Speaker of the National Assembly. It is dated. It is saying, the heading there, dear Mr. Frolick, request for an urgent convening of a portfolio committee on health regarding the vaccine rollout plan. I'm therefore saying, honorable members, as we meet today, we already have been, in fact, instructed, we would wish to. So for those members who might actually, in their presentation, Dr. Zweli, why did you bring us much earlier than we thought? I'm also under this instruction from the Speaker. The letter came from Mr. Frolick coming into me as it was addressed to him. So the Speaker writes, my office has received correspondence from the Chief Whip of the opposition party, the DA, dated the 30th and the 31st of December 2020, requesting that I reconvene the National Assembly in order to debate as a matter of urgent national importance the rollout of COVID-19 vaccine plan. On the 4th of January 2021, the Chief Whip of the opposition party submitted another request to reconvene the House in order to establish an ad hoc committee on the government's COVID-19 vaccine rollout. Now, the issue of government's COVID-19 vaccine rollout plan is an important matter to which our parliament should pay particular attention in its oversight function. However, I do not believe that it's necessary either to hold a special sitting or to establish an ad hoc committee in order to do that at this stage. This is a matter that falls within the scope of the Portfolio Health Committee. Accordingly, may you please ensure that the Portfolio Committee on Health is convened on an urgent basis to attend to the matter of the government's COVID-19 vaccine rollout program. As the committee is currently also attending the matters pertaining to national health insurance, I request that an assessment be done on its ability to pay the necessary attention to both issues. I will appreciate your regular updates on these matters. Yours sincerely, the Speaker. I'm reading this letter, honorable members, because I'm also aware of the minister's plan with regards to how to assist the National Assembly with this process. So it's not actually from the point of view delaying or refusing to do these issues, but the instruction that was coming in from me that this committee must up the game. You are actually supposed to be playing our role so that the issue of an ad hoc committee on an implementation management of a vaccine in the country is handled and is known by us. We do an oversight on that. That is what the letter actually was impressing. But it does not close a space for the minister indicating and all of us saying yes, because at the end of the day, if there were to be a debate, which the Speaker is saying is not closed, that is not going to happen. But maybe the people who would be able to handle that is themselves, honorable members. So this meeting again, praising you of the status of the COVID-19 in the country, and the vaccine update is critically important so that the Speaker can actually be able to say to all parties, members who are actually dealing with this matter are very well versed and maybe they can be able to be debating from an informed position. So the letter is not saying there's no debate, it says at this stage. So maybe our engagement today might be able to tell the House, the leadership of the National Assembly, when to get that special sitting to deal with these matters. If that sitting was to sit today, nobody has any information clearly as to lead and support from all various parties. We hope that Minister, this is going to assist us today, is also going to be able to make your plans as to when you think you can be able to deal with these issues on the National Assembly platform. Then let us then move to the second correspondence. The second letter comes from the Deputy President of the EFF, Honorable Shivambu, and the Chief Whip of the EFF. And I will start reading it while we are looking for it there. I just want to notice that this letter apparently was distributed by email on the 6th of January 2021. The Honorable Shivambu addressed it to me, and I only received it yesterday. The Portfolio Committee on Health meeting, briefing with the Minister of Health, Dr. Zweli Mkhize, on the status of healthcare service in relation to the COVID-19 and rollout strategy of the COVID-19 vaccine. Dear Dr. Dlomo, we write as an EFF to request that the Portfolio Committee on the Health must invite the Minister of Finance, Mr. Tito Mboweni, on the National Treasury for the upcoming meeting scheduled for Thursday. I think there was a typo there. Honorable Shivambu wrote 7 November, too far away. We will not be there then. We supposed, I think it was a typo, it was supposed to be 7th January 2021 for the briefing with the Minister of Health, Dr. Zweli Mkhize, on the status of healthcare services in relation to COVID-19 and rollout of the COVID-19 vaccine. The scheduled meeting is very important, and many of the lives of our people during the COVID-19 pandemic will depend on the strength of the public representative through committee work to interrogate the work of the executive and ensure that the rollout of COVID-19 vaccine is accessible to all in an efficient manner. Over the past months, particularly recently, as government all over the world are making efforts to secure vaccine for their residents, it has become more apparent that one of the key issues of securing vaccine is availability of funding. We made notes of reports that South Africa payment to secure vaccine was late, and the payment made was through Solidarity Fund, a non-governmental initiative. For a substantial of the Minister of Health's presentation, it would be beneficial for the Portfolio Committee to have the Minister of Finance present to engage all questions pertaining to the funding. We hope you'll find our request in order and will urgently engage the Minister of Finance to avail himself to get with the National Treasury, signed by EFF Deputy President and Chief Whip, Honorable Shivambu. Now, I received this letter yesterday. I was not able to process what Honorable Shivambu is requesting here. I was hoping that today's presentation of the Minister of Health will indicate the gaps, if there are, where we might need to invite the Minister of Finance. We would be guided by the presentation, but sometimes you would find that the Minister of Health might indicate that, look, as I'm presenting, I have my colleague here to add or to say something to add to what I'm saying. So we'll also be discussing that and see if there is going to be a need, which I'm not going to oppose, of us having a meeting with the Minister of Finance. But our direct link in government is with the executive member of health. And therefore, I am reading this again so that Minister Mkhize can also be aware that we have received this letter, and in his presentation or in his comments, he can actually be able to indicate this. I will still have to also correspond properly with the leadership of the EFF with regards to this letter, that we were not able today to invite Mr. Tito Mboweni because the letter just came now and we did not process it properly for this meeting. I'm also saying that, honorable members, those correspondence you may respond to when the time comes during your presentation. That is why we've opened the meeting quite long, finishing at 12. So I would then now want to take this back, noting this that have come through to you, take this back to the Minister of Health to then give us a presentation on the status of COVID-19 in the country, together with the update on vaccine. There are a lot of issues, Honorable Minister, that are all over there, scaring other people. But I've said to some of the people who appear scared, when you go to any hospital, you don't get children discharged without a BCG. That's a vaccine. That's an immunization. It is given because health experts have advised us in that way. So now, this is just another vaccine for a specific disease. At least let us have other issues other than to say, should we or should we not have a vaccine? That must actually be behind us. The point that maybe in your presentation will have to come through, which I've also heard, is that are we not really too late to get it on that date rather than earlier? Could you be able to make a promise and indicate to us a possibility of an earlier date in terms of plan? I was also saying, while sitting at home, you get people who are teachers say, but why are we not prioritized on this matter? I've also not been able to say, yes, you are, because I was not aware that you are looking into that matter. So quite a lot of things that you might actually have to assist us to understand going forward so that we can be able to engage. I'm not closing a space for members to engage with you. I was just going to I'm giving you just highlights of how urgently we need to engage with you and thoroughly understand the issues that you are handling. I now take it back to to Minister Mkhize and his team to engage and assist us to understand where we are as a country on COVID-19 update and together with the update on the vaccine of this COVID-19. Thank you very much. Can I then get it to the Minister of Health?
Thank you very much, Honorable Chairperson and the members of the Portfolio Committee. Let me start by also expressing our best wishes to the members and compliments for the new year. We hope that 2021 will be a better year, and certainly I hope that the members have rested and they have a very challenging year ahead. And so one is hoping that we will continue to work together in the way that we have in the past. We have had apologies tendered on behalf of our team. The Deputy Minister is in a meeting which has been convened by the President, and so is not able to join us. The Director General is involved in the issues of our vaccine acquisition, the urgent matters that he's dealing with. And so we're not in a position to be here, but Anban Pillay, Deputy Director General, and other members of the team are with us in this discussion. Let me start also by conveying my sincerest and deepest condolences on the loss of the Honorable Janji. It was a very sad and shocking news to learn of her passing. We know her lifelong dedication to serving our people as a humble servant and as a doctor who has actually foreign countries to serve our people. We have worked together with her during the days of exile when she worked in Zimbabwe, Harare Hospital, Parirenyato Hospital, and some other hospitals in Zimbabwe. Having been trained as a doctor from Cuba, I was always struck by her professionalism and her respect for people and her dedication to her profession. So we were quite saddened to learn of her passing, and therefore wish to convey condolences to the family, to the friends, as well as to the colleagues and members of the Portfolio Committee, National Assembly, as well as comrades. I have also, there's a letter going to the Speaker's office, wherein as Minister, I've also requested to make a statement to the House. And so hopefully one would have a sense as to what the scheduling would be like, but that I believe it's important to also make a minister's statement on this matter in relation to the COVID-19 situation. I have noted the report about the letter from the EFF requesting Minister Mboweni. I can just say that I do know that Minister Mboweni would not have been able to attend. In any case, he's got a family bereavement, and he advised me that he was dealing with that situation when we had other issues to discuss. But issues that might relate to Minister Mboweni in relation to this matter that we'll discuss today, I will cover some of that. I'd like to just take you briefly to the history of our engagement on this matter. Firstly, to say that the nature of the pandemic has actually been quite devastating throughout the whole world, but a number of countries have faced what has been called the second wave, wherein the resurgence has come back to decimate more lives in different countries. We have been unfortunate as well amongst those countries that have had to face this second wave. And in this case, we have seen the country's figures going beyond 1,120,000. Excuse me. We've also seen the fatality rates going up beyond 30,000. We have also seen the numbers of hospitals getting filled up, particularly in the private sector. They've actually been much more under pressure. And of course, now it's spread to the public sector as well. The issues which have been of concern is that there's been a huge demand on beds, huge demand on oxygen, and demand for additional staff. So we have asked that there must be the reactivation of the beds that had been decommissioned in some of the areas. And our record so far is showing that in all the provinces that have been affected, mainly Eastern Cape, then Western Cape, then KwaZulu-Natal, now we're moving towards Gauteng. In these provinces, we have seen that the numbers have actually exceeded what was the total at the peak of the earlier surge. Now, Gauteng is still rising, and we still believe that it's going to be much higher than where we were in the last surge. KwaZulu-Natal has already gone almost twice the numbers of patients who are being admitted as compared to what it was before. You will also have seen that the same situation has happened in the Western Cape, where the numbers have far surpassed the peak that we had in the last surge. So the challenge, therefore, is that it's a little bit more severe than what we have had before. We have also had lots of pressure because our staff has been fighting the COVID-19 situation, and at a certain point we would have liked to see them resting, but the surge returned even before many of them had been able to rest, and so the level of exhaustion is quite noticeable on our staff. So the major thrust this time around started with the Eastern Cape, and then it extended to the Western Cape, as well as the KwaZulu-Natal and Gauteng. So that has necessitated the need for us to embark on the stringent measures that have been put in place, particularly because of the nature of the festive season, where people will be congregating in large numbers, overcrowded situations, and therefore that was going to exacerbate the problem, taken together with the fact that there has been quite a degree of complacency in the use of masks. And so people were, I think, under impression that level 1 means that they will no longer have the problem. So this has been the challenge. But what has compounded this situation is the presence of what we call a variant. It's a variant which we call 501.v2, which is basically an indication of a slight change in the structure of the virus. Now, this is not only a South African phenomenon. We've seen a similar thing has happened in the UK. We've seen it in Brazil and Australia, although the variants are slightly different. And in our case, there has been an indication that our variant is quite different from the one that's happened in the UK. However, both the variants seem to be equally highly transmissible, and therefore the similarity between both the variants seem to be equally highly transmissible, and therefore so the challenge, therefore, that we have to deal with is that a lot of research is being done to look into the impact of this new variant, in particular the issue of to what extent is this more virulent, and there's no evidence that it's more virulent. There's also no clear evidence as to what the impact would be of the vaccines, and so all of that work is underway, is being dealt with at the level of the researchers. So from that point of view, it's important just to say that there's a huge amount of experts in genomics that are doing work as a consortium across the country to deal with new information that comes from that level. I must say South Africa is working with a number of international partners as various countries that are advanced in this level. It is quite clear that we're dealing with cutting-edge technology here, so we will always know as much as anyone else in the world would know about this virus. Then it leaves us now with the one reality that is, excuse me, the reality that to deal with this issue, the only major source of protection is going to come from the vaccination program. And we believe that in South Africa, if it was possible, everyone should actually have the vaccine. But in terms of our current calculation, you need a minimum of 67 to 70% of the population to be immunized so that you can break the cycle of transmission. That is what we call the herd immunity, and that is based on a calculation that is made by scientists on the basis of the transmissibility of the virus in terms of how many people each person can be able to infect, as well as the various other factors that have got to be looked into to calculate what would be the safest number of people that would limit the spread of the infection. We then embarked on a program to collaborate with various partners in the world to look into the availability of the vaccines. And then we had agreed, at the time we started this discussion mid-year, the issue was in particular about two approaches. One approach was that we worked together on pooling the numbers of countries together to try and create a degree of safety by ensuring that we have large numbers of countries that can negotiate better prices. At the same time, we enrolled in the COVAX facility, which meant that they would be looking at about 9 vaccine candidates that would be working on to see which one would be successful. There were no results that were showing, except that everything had been done in the laboratories. So the other option was a bilateral agreement wherein countries were expected to put some contribution immediately and bind themselves to the fate of that particular vaccine, which meant that some of the amount that would be contributed would be non-refundable, but it meant we would be taking a risk on the particular vaccine, even though it would be a one-on-one. So we felt that the risk was too high between the two programs, and we felt that it was important for South Africa to work with those countries that would first find out what the most successful vaccines would be, and then we would then start following the issues from there. So we have then affiliated onto the COVAX facility, and then we committed for the payment of 10% of vaccine, which is worth 10% of the population. So there were a few delays in the payment of that vaccine. There were not, major issues that would have warranted the degree of anxiety that could have been generated when the payment process was a bit slow. So what actually happened in that case was that the Treasury had advised that what we needed to do is to raise the money so that there's no need to immediately tamper with the budget framework that had been tabled. And so we needed to look at what can be done, looking at the additional support that we got from the Solidarity Fund. And this was very helpful. And then it made the process to move fairly quickly. On the other hand, between Gavi, which is the Global Alliance on Vaccine Initiative, that Gavi was negotiating terms of the agreements. And in that process, those terms of agreement meant that there were to be guarantees. So there was quite a lot of discussion between the legal teams on both sides. That is what really caused the delay, to say what is the best way of expressing this kind of guarantee. And then between them and Treasury, it took a while to resolve that. But they had acknowledged that there was no risk to the South African participation in that process. And so that was ultimately resolved. And as we speak now, that amount of money was paid and the guarantees were signed. And the amount that is guaranteed is actually in the budget, and that was sorted out between the Department of Health and the Treasury. So the issue of COVAX was actually sorted. So the President announced that, in fact, in terms of the COVAX platform, we were going to have we will have the first vaccine into the country around April, and that was the timelines that have been given to us by the COVAX facility. But by the time we got to that point, a number of results had now come out to indicate what progress we were getting in terms of the success of various vaccine candidates, and there had been a lot of announcements. On that basis, it gave us enough confidence now to be able to start engaging the various manufacturers. So there have been engagements on a bilateral basis with various manufacturers. There's been one platform. There's another platform, again, where the President Ramaphosa had created a task team which was looking at the continental access to vaccine, using the large volumes of the continent to actually leverage better prices. And so we started getting engaged in that kind of process. That process gave us a lot of insight in terms of what the various manufacturers were offering, what volumes or what quantities clear amongst all countries, particularly those with high-income countries, particularly in the West, US, the Eurozone, the UK, had actually committed funds on a risk hedge basis much, much earlier, a kind of luxury that South Africa was unable to afford because of our limited resources. And so they actually purchased literally each one of the several vaccine candidates long before even the results came out. Now, we were looking at that, and we were advised that, in fact, that was going to be much more riskier. But once the outcomes were beginning to come out in terms of the success of the various vaccines, we were then able to now start engaging. So we have non-disclosure agreements that were actually signed much earlier, from September, October, and so on. And these were basically to allow the manufacturers to share information with us, which would have been otherwise sensitive, which would have needed to be protected, as we're now trying to look at what the best ways of dealing with these vaccines would be. There will be a presentation that's going to take us through the kind of selection process of which vaccines we thought needed to be considered, as advised by our Ministerial Advisory Committee. You will also go into a bit of detail as to what is there amongst those particular vaccines. I think as we stand at this point, a few points that I think are important to mention is that, for one, we have had lots of discussion with the Minister of Finance, basically to say that the fiscus is going to carry the major burden of having to procure the vaccines. In the process, we've also agreed that we will look at and activate other means of raising additional funds, and that is the second way would be to approach the medical schemes and ask them to make a contribution, which will also be on the basis of social solidarity, wherein they could also cross-subsidize some of the members of the public. And the third one is to get donors, business to also make their own contributions. And so these together could be work together with the Solidarity Fund. So quite a lot of mechanics of making this system to move on are in place. The Ministerial Advisory Committee has given us an outline of a framework of what we needed to do, and that will be shared as well. Amongst the issues that were important were the question of prioritization of different sectors of society, starting with the ones who are most vulnerable, and then going right through in stages to be able to ultimately reach to all the members. So we have actually engaged a number of manufacturers, and we're at a stage where our discussions are fairly sensitive, and we believe that we should be able to conclude as much as possible. We did indicate that we were pushing to get now access to some vaccines so that as early as February, we should be able to get to that point. So I want to hold that for now, just to say that we'll take through the portfolio committee through the presentation, but also at the same time, it's important for us to note that there's quite a lot of anxiety in the society. It's largely because the resurgence of the COVID-19 has actually, kind of created a lot of panic with the numbers of people who are getting sick, the number of hospitals that are having, that are filling up, and the numbers of lives that we are losing. It is actually natural that we should all be anxious at this point. I'd like to just say that this situation will manage with the best of our abilities, but also we will be making sure that we bring the vaccines as quickly as possible into South Africa. By the time we start the vaccination program, we won't be very far different from many countries. We would actually be all in line with most of the countries. So we would like to assure the public that, in fact, we are all on course insofar as this matter is concerned. We have noted there's been quite a lot of comments and concerns and criticism coming from different parts on the public. We want just to acknowledge that, yes, the issue has to be debated because it's a matter of public importance, but that the government has actually been on course when the matter is actually being handled. There will be vaccines available. They will be available in stages in terms of the high risk of the population. That is, we will have advised, we will go through those priority lists as we move on with the presentation. That at the end of the day, South Africa has actually, as a country, been focused on the best possible way of dealing with this COVID-19 situation. And therefore, we don't feel that the anxiety must make people feel that we have basically got ourselves into a more difficult situation than any other parts of the world. Yes, some countries have just started vaccination. We will also be starting our vaccination program soon. And so we believe that the whole of next year we'll do our best to vaccinate as many people as possible. Our target being the 40 million people that we have put on as a requirement for the herd immunity. And of course, like any other countries, there may be challenges with the logistics. Will indicate how far we've gone with that plan. I want to leave it at that for now, and then say to Honorable Chairperson, if we could allow Dr. Anban Pillay to take us through the presentation. I will come back afterwards then to make concrete, to make the closing comments. And if there's anything that I need to also clarify, on the presentation, I'll do so. Thank you very much for your patience, and if we could allow Dr. Anban Pillay to come on and table the presentation.
Okay. Okay. Yes, Minister, that has been extremely helpful. We will now move on to the presenter, Dr. Anban Pillay. But I think your opening remarks were quite detailed. They have been of great assistance on the matter that we're dealing with. We are beginning to formulate already our clarity-seeking questions to you, even based on what we have just said. But let us then move into the presentation as presented here. Honorable members, I've noted your raising hands, the wanting to speak, and I've noted you. Please go on our WhatsApp group and see where your name is appearing and indicate if the only person I have not indicated, I've put her there to speak, even though she didn't raise her hand, is Dr. Tembekwayo. You will also appear on the list. You can then decline when the time comes to you, but already look at your list that I've already formulated for members to ask questions. Thank you, Dr. Anban Pillay.
Well, can we ask the administrator to open up so that we can share? I can continue with that presentation. I'll make it quite brief because it sounds to me like Dr. Anban Pillay might have been having some problem. He was dealing with another sensitive matter as we were starting this discussion. So I will just table that presentation if we can be allowed to share. It said only the host can share, so I think we might all be having a challenge there. Could we be allowed to share?
Ms. Machalamba, can you assist us?
Is that visible, Chairperson?
Clearly visible, Minister. Thank you very much.
Thank you very much. Let me try and then walk through this because the understanding was that Dr. Anban Pillay would be in, but I've just got a note that there's some crisis. I think the numbers of issues that we're handling that right now. So I will just proceed. Basically, I think the first point which I want to make, if you look at the numbers as of the 6th, is 1.149 million. That was published yesterday. Then we have a case fatality of 2.7% at 31,000 individuals, with recoveries at 929. That comes to about just 83% or so. That has been an increase of late, which is indicating the severity of the second wave. The point which I think is important to watch here is that the first graph is showing on the left the first surge to June to August, which has now started again from end of October up to currently where we are. But the difference between the two is that the gray graph is showing how the Eastern Cape was the first, whereas in the previous one it was Western Cape that was the first. The Eastern Cape has already started plateauing, although we're still having a lot of reports then which were correcting in terms of ensuring the accuracy of the fatality numbers. But nevertheless, the number of new cases is already on its downward plateauing effect, if you can see. Then the yellow line or the orange is actually the Western Cape. And again, Western Cape, what is visible is that the Western Cape, the cumulative numbers, as you can see, the 7-day moving average it's already gone to twice the height of what it was in the first stage. In other words, when you run into, when you get to the Western Cape Health Services, you will notice that they've run out of oxygen. They were to, do emergency support for that. It's mainly because the numbers have increased far higher than what was previously experienced. KwaZulu-Natal, exactly the same. You see the numbers there. The current trajectory is showing that it's almost twice as high as what it was before. And next to it, rising steeply, is Gauteng, which is still going to show in the next few weeks when the people return to Gauteng after holidays. So we expect that the pressure is going to be building up onto Gauteng. Already as it is, it's already 2/3 of what the height was before. So the numbers are expected to be much higher. Then the other provinces have got similar kind of experiences. As you have heard, Limpopo, Mpumalanga, they've got issues that they are managing. So this is the indication of our second stage. This graph is showing already that deaths, if you look at the red graph, the deaths are already higher than what we ever experienced before. The admissions are already higher than what we experienced before. The new cases on a 7-day average are also already higher than what we experienced before. So we have then worked on the framework for vaccine implementation. Here we're looking at some of the governance structures and the system of what you need to do. So we have to look at the governance structures. We're looking at the issue of communication and stakeholder engagement. And then the whole flow chart that's talking about prioritization of the population, allocation of vaccines, distribution, supply to point of use, administration, and then issues of safety, and following up on second dose. Then a link to that, other issues which really depend on a huge data monitoring, supply monitoring and tracking reports and vaccine uptake, adverse effects, events following immunization. All of these are issues that you have to actually monitor with a very reliable data system. And then regulatory considerations and finance. Now, this point I'll just highlight, I've made the point already. We need to prevent morbidity and mortality and ensure that there is a protection of the entire population. That's what we call population immunity. That becomes very important. And the principles of what we need to do with the vaccines is that the government must be the sole purchaser, and that we'll be using a multiple supplier approach, where we'll be using a number of players who are going to be supplying us. But just to know that if you get one dose from one company, you must get the same dose from another, from the same company. The second dose must come from the same company. You don't mix the two doses. And that we are guided by a Ministerial Advisory Committee, and that we have to have a pre-vaccination registration, and then must be a national register and a rollout committee. This is an outline of what would be in the committee, largely departmental, but then of course you've got SALGA, you've got private sector, you'll have civil society and WHO. Then other stakeholders that will continue to guide us here. On the one side, we're going to have to be having the Ministerial Advisory Committee, and that will all continue to focus on the issues of behavioral change, issues of technical issues around vaccines, emphasis on non-pharmaceutical interventions. Then the labor, we need to work very closely, because a large number of our health workers and some of the essential workers are going to be linked to the unions, and there are issues of safety that we've been discussing with the unions. We also need civil society here. It's important that we need to have societal buy-in onto the issue of the vaccines. Then, of course, some on the private sector, we're going to be working with the private health sector, medical schemes, hospital association, private hospitals, and pharmaceutical associations, and so on. Effectively, as I said, there are three ways of how we're going to be looking at the support from the private sector, pulling off funds to support vaccination, promoting the use of vaccine amongst employees, and provision of a vaccination platform on occupational health systems. Then identification of and prioritization of target population. Here we're guided by the Ministerial Advisory Committee we're looking at those who are most at risk, and therefore we group them up into various groups. The first group are those who are going to be in high risk, who are highly targeted, so that we need to make sure that health workers, frontline health workers, are on the first category, which is our first phase. The second phase will also extend to those with comorbidities, the old is over 60 and so on. And we will then have quite a lot of activity on the second phase that will be linked to the availability of more quantities of vaccine. And then after that, this becomes a continuous vaccination that will happen long after so that on a continuous basis, everyone else gets covered. Then when we talk about health workers, basically all the categories of health workers, even though they are seemingly categorized here, but they will all be covered. And then, of course, phase 2, we have to talk about essential workers. That covers those frontline workers, teachers, police, military, miners, and other people who are working in settings where they're serving communities. So the population exposure, the exposure to the infection because of their service to the community. So those are the groups of people. And then, of course, those with comorbidities are going to be the phase 2. Those are the with underlying illnesses, HIV, TB, diabetes, and so on. Then there are a few issues which we're still resolving on the issue of vaccines. Pregnant women, we will not immediately include them until we've got the issue of safety properly indicated there. Then the other issue that we still want to get a bit more clarity on are the people who have been already previously infected. Do they get the antibodies? So that issue is being worked on, so we'll get proper advice. Then what do we look for on the vaccine? And this is how we've been guided. So just to decide whether the vaccine, because we had 200 candidate vaccines, so the ones that you are going to talk about are those where there's safety issues, efficacy issues, and immunogenicity has been well established. In this case, about 11 of them have got that kind of situation. So we can now start talking about all of that. Then secondly, we have to look at the supply. So for example, if someone has got a very good, there's got high efficiency, high efficacy vaccine, and it's safe and everything, but then it's too expensive, it might be an issue. But maybe it might be if the vaccine is good, but they are so booked, they're overbooked that they don't have vaccines available until 2022. Obviously, we can't deal with those. We have to look at others. So that's what is involved in all the negotiation. So we have to start looking at the ease of use, stability during the storage. All of those issues become important. Then the issue of cost and registration are part of what has to be looked at. So the number of vaccines that we're looking at. So for example, we've looked at the Pfizer. In this case, they've already been registered, high efficacy, and then there are storage issues that we have to look at. Then the AstraZeneca is the other one that has also got some approval in some of the jurisdictions, very efficient, and both of these have got 2 dosages. And so the other one is Johnson & Johnson. Part of it is also being prepared in South Africa between Johnson & Johnson and Aspen. And so again, they are working on regulatory approval. And so we believe that we need to focus on this because it's very promising. Then we've got Moderna, which is already being used in the US, which we are looking at. Then there's also Sinopharm in China. And all of these are actually very high efficiency vaccines. And all of these now are what we've been looking at together with our Ministerial Advisory Committee. So we have to make sure that the issues of safety are attended to. On regulatory matters, they have to look at where they are registered and that they have submitted the necessary documentation. The process has to be done properly. But what we are having is that the SAPRA has got a special task team that is facilitating the registration of vaccines. They can also do authorizations in terms of Section 21, where manufacturers have not submitted dossiers. And if we think that all the evidence is pointing at the very useful vaccine, that can actually be also taken into account. So we have noted as well that there has to be because of the new technology that's not been seen before, there has to be quite a degree of active and passive surveillance, which we're going to have to work together between the department, WHO, and SAPRA, just to make sure that everyone who's got a vaccine must have a kind of like a yellow card vaccine card system, which you keep, that always shows that you've actually had the vaccine, and the 2 doses will be recorded there and their dates of administration and so on. They also have to run what is called Med Safety app, which is to look at people with adverse effects following vaccine immunization. It's also important to make sure that we monitor because the development of the vaccine has taken place over a very short space of time. Then we look at various ways of distribution mechanism, and here we have to either look at central distributor, where we receive from the manufacturer to a central distribution, or you've got a situation where we've got a mixture with central distribution and contracted distributors, or you've got a situation where the manufacturers are contracted directly as distributors, or we have the supplier-distributor situation. That will then cover on the right public hospitals, vaccination centers, mobile clinics, private hospitals, pharmacists, and so on. So that is being worked on now so that we can clarify we can refine the process as we move on. Then the issues of security, distribution security, vehicles must be tracked, and all of that, simple basic issues of making sure that you don't have excuse me, you don't have a problem of tracking where the delivery, the stock is. And then, of course, the issues of tracking and tracing of vaccines with barcodes, so you know who got from which particular bottle, which particular batch it came from, and all of that. Safe disposal of a vaccine is going to be an issue. Verification of distributed volumes and what's been distributed, what's been administered. We need a whole lot of system to deal with that, including the issues of monitoring wastage. So there will be a number of programs here. Some in the phase 1 group will be having people who will be vaccinated from hospitals, where staff can be just approached in the hospitals. And there's a whole lot of issues there because the slides have been distributed. I won't waste time. Then the other outreach programs where we will actually have a team that goes out. We call that hub and spoke model. So you get one hospital, and then it rounds up all the clinics and the centers where health workers are, so that in that particular district everyone is covered. So that's another way of looking at it. Then there are also vaccination centers. This works well in the urban centers. We've seen that happening in Europe, where they put up a center in a city because of the proximity within suburban areas. Makes it easy to access health workers that are needed, so they can actually move to that center and get vaccinated, and that should be it. So that is another way of. So those are the different formats of how this is going to be dealt with. And then it's just the distribution within the health workers, so that where do you find EMS staff, where do you find health workers, community health workers, and so on. Then the other delivery platforms that have to be considered are pharmacies, mass vaccination centers, and then community halls, churches, and so on. So all of these, as you go on with phase 2 and 3, we're going to be considering a wider range of mechanisms. Now, these are indicative figures of what it would mean. For example, we did 40 million people over 12 months. It's a huge task, and it means we'll have to really target huge numbers, 316 per day, and so on. When the machinery is working very well, it should be able to move up to that level where each vaccinator can vaccinate 50 people per day. It's going to be quite a huge run. We're targeting about 6,300 people and drawn from clinical associate, community service, doctors and nurses, contract nurses who are involved in other programs in vaccination, etc. So we're looking at targeting those people. For every province, we need each one to appoint someone who's going to deal with the cold chain management. And so that's the other issue. Then we have to deal with the integrity of the whole process to ensure that vaccine confidence increases. because of transparency and the effective management of safety issues, and also ensuring that the reporting of any side effects that are detected, and I indicated the yellow card system, and I also indicated the safety issues. Those are going to be all have to be built into the system. The issue of training is going to be important. Our partners, civil society, business unions, all of them that have to be part of our communication system so that they can talk to the members out there and talk to the public. It's important to align the messaging. Right now, we've got so everyone saying different things. It's important that we must actually send one message so that we are able to get everyone to understand what exactly the program is all about. So there's additional work that has to be done, development of materials and all the other issues that are indicated there. And so the need for a very strong electronic vaccination data system, which is national and centralized, so that you can always find. If you want to know if Zweli Mkhize was vaccinated, you must go and check somewhere. Maybe they lost their card and you want to now redo their card before they travel, so you can be able to do that. And so there's quite a bit of tracking of specific issues, the identity of the individual, who's the manufacturer, what's the batch number, what clinic administered this. All of that information needs to be dealt with. And so there has to be a link between NHLS and NICD. The issues of consents, for example, if someone says, I don't want the vaccine, if someone has to do the vaccine, they've got to sign somewhere as a kind of consent. So all of those issues are being taken into consideration. Then you must have a dashboard that's able to monitor. If you want to know every day how many people are vaccinated, you must be able to find all of that. So all of that information needs to be kind of recorded somewhere. Then there are responsibilities for the National Department of Health, which basically are around finalizing the model and establishing coordinating committees and also supporting the provinces. The same thing with the provinces. They've got to also do a similar arrangement where they've got to also go procure needles, swabs and everything, so that when all of this thing is put into operation, we can start the process. This kind of work here is a kind of work where you do the plan, that's one thing. But to actually make it work, it can only be proven once you've started to administer. Then you know what are the weaknesses in the system, and then you can strengthen it at that point. So we don't expect that everything is going to be perfect as we start. We believe that things are going to be strengthened as we go and we learn from the system. When we started the engagement much earlier, we're then trying to look at what could be the indicative figures. These figures are not really accurate, but they were figures that were based on just a kind of modeling process, just to say, what could it be? So, for example, if you were to take 5% of the one and 5% of the other and so on, I'm just giving you this as an example. This is not how it's going to ultimately pan out, but just to give you a sense as to, at the start, when the results came out, what were we looking at? So we then use that to guide what the quantum of resources that might be required here. So it doesn't say this is a budget. It says to us we have a sense as to where the cost is going to ultimately lie. So let me leave it at that with this issue, and then just make one or two other points. And the first point which I want to make is the fact that the Treasury has allocated amounts. It's not fixed at this moment, but they have come to the party to say they are working with health to make sure that health requirements for funding will be covered, and health is going to be dealing with all the logistics, the procurements, and so on. We're going to have a special kind of dispensation that's going to allow a deviation so that different manufacturers can be engaged, as we already currently are engaging them. There's quite a lot of discussion that is going on between the department and the various players to be able to get to a point where we can say we've got our orders confirmed, and so Treasury will be allowing the process so that there is no difficulty with the procurement processes, that you can speedily procure and purchase and pay and get receipt of the particular vaccines at a particular point. If I can just hold that, Chairperson, I'm sure there are many issues that I have left out, but the members might want to raise those, and then I'll try and deal with them as they come. Thank you very much. At this point, I'd like to hand over back to you, Chairperson. Thank you.
Okay, thank you very much, Minister Mkhize. Mkhize, you must have a big glass of water next to you. You made a very detailed opening remarks, and we have now presented to us, and there are honorable members who would like to ask questions. Honorable members, may I request you, because these issues of critical importance, there are recordings that we are taking. We like to see and know who's talking. That is what the parliamentary staff has actually advised me. Number two, we are very welcoming to the media. This meeting has got 76 participants. And of course, we are just 11 of us in the portfolio committee. And there's 4 leaders from the Department of Health, including the minister. There's going to be about 6 parliamentary staff supporting us. So there's been a huge interest on the media, and so this matter is at that level, Honorable Members. I'm just informing you. Please switch on your camera at the time that you are speaking. I'm going to read the first 6 names of the members who will speak in this order. The first one is Honorable Jacobs. The second one, Honorable Wilson. Third, Honorable Kwahube. Fourth, Honorable Ismail. Fifth, Honorable Van Staden. And sixth, Honorable Chirwa for the start. We'll take the other 6 after this. Please, honorable members, if I could, to save time, let me not come in between the 6 of you. If there's a pause of more than 30 seconds, I'll take it that you are struggling wherever you are, and then we'll move over to the next speaker. But if these 6 honorable members can speak one after the other, Jacobs, Wilson, Kwahube, Ismail, Van Staden, and Chirwa, then I'll come with the other 6 thereafter. Start, Honorable Jacobs.
Thank you, Chairperson. Thank you, Minister, for the presentation. Happy New Year to everyone present here today. And I think it's a very good time for us to have this portfolio committee meeting. Very early in the year, I also want to congratulate our members who were willing to participate in a meeting outside of parliamentary time. So, and also, thank you very much, Chair, for the honors given to Member Pumza Janchi. I have 5 points I want to speak on. The first one is on the letter of the House Chairperson, but we want to thank him for the letter. We also want to note what was put in the letter, and we also appreciate, Chair, the answer that you had given with respect to our role as an oversight committee. And yeah, I'm speaking of the request of an ad hoc committee to have been formed at Parliament. I think it wouldn't do justice to ourselves for us not to fulfill our mandate. And our mandate specifically is to have oversight over processes and procedures. And we appreciate the input from the House Chair that we will accept, and we will perform our role as oversight committee over the COVID vaccine rollout. On the second part is from the letter from the Chief Whip of the EFF. We accept your explanations. We know the content, and we know the request of the letter. We thank you for your explanations, and we also understand the explanation as given by the Minister on the bereavement of Minister Tito Mboweni. My third point is on slide 3. If you would notice, there's been a great increase and progressive increase in the number of infections, and the rate of transmission is higher now with this new variant. However, I'm very concerned about the discrepancy between the number of infections and the fatality rate. As shown in slide 3, especially between the provinces. If you look at the number of infections in Gauteng being at 304,442, with a fatality rate of 1.9%, and the Western Cape at 223,888 and a fatality rate of 4%. It tends to make one very worried about this when you see this difference. But then I also noticed in two other provinces there are high fatality rates. For example, in the Eastern Cape at 4.7% and the Free State at 3.4%. And that begs the question, what would be the contributing factors? And I'm raising this with the Minister. What would be the contributing factors which would make us have such great variance? Some provinces at 1.2% and some up to 4.7%. But in terms of the numbers, Gauteng with its big numbers having a lower fatality rate. Now, I've noted what the Minister raised in terms of the number of beds, the number of increased admissions, the increase in the new cases, the difficulty and challenges with oxygen and staff, etc. But really, we need to address this. And this takes me to my next point, that as much as we are waiting on the vaccines, and we understand that this situation of the vaccines resides with the NDOH and it resides with the ministry. And while they are doing this work on acquiring the vaccines and working on the rollout plans and us doing our oversight over that, there is something immediate that needs attention, and that is the clinical situation. Our clinical situation in terms of are we providing the necessary treatment to all of our patients in order to increase the survival rate. And that to me is a very, very worrisome thing when I look at the number of deaths and you look at the graph, where there's an escalation and a growth, which up to 6th of February, which was yesterday, 6th of January, which was yesterday, we saw that increase in spike in the number of deaths. And obviously it goes along with the number of infections. And we've already spoken to the transmission rate of the infection in terms of the new variant. Because the other challenge that we will face later is that increase in the number of chronic people with chronic diseases post-COVID infection. And we need to be able to stave that off or prevent that from happening. For example, lung challenges, challenges with lungs, etc. On the vaccines, thank you for the work that has been done to here and the progress that has been made. I am concerned about the many myths and the wrong messages out there. Now, we need a program to be able to answer those and address those points. We only need to look at the eradication, and this is our general public. The eradication of smallpox in the world. Now, smallpox was emaciating the population in the late 1700s. It was a huge problem in the world, and in 1796, the very first vaccine that was formulated was to be used against contagious diseases was that for smallpox. And the world has been able to eradicate smallpox in the same way we can speak about polio, measles, BCGs for TB, etc. Therefore, I think we need to ensure that we get the right message out there, that we demystify this. And I think the role of the media, them being present here today, is important to put out the right message, that the vaccine is important, it is needed, and that they shouldn't be spreading some of the myths and the wrong statements which are put out there. And I'm giving the example of smallpox. And then we also noted in terms of the vaccine, the press statement released by the Premier of the Western Cape, who said that they would procure the vaccine as a province. Now, we know that this is a program that is rolled out by our National Department of Health, aligned with the ministry, and I would like the minister maybe to speak on that issue when there's a direct opposition to what has been put out, having listened to the minister on television the other day, that there's going to be a national procurement process. And then finally, Chair, I think we need to continue with our message of preventative measures. On the one hand, I'm talking about the clinical treatment and being able to save lives. And on the other hand, our public has a responsibility to save lives themselves and save their own lives. And I think we're faltering a little bit on the message of the non-pharmaceutical intervention and getting that message out there again. Stay at home, social distance, wear your mask, wash your hands with soap and water preferably, sanitize with the sanitizer if you don't have, and follow the rules and abide by the rules and regulations of our country. Thank you, Chairperson.
Thank you very much, Chairperson. From the outset, may I just, on behalf of everybody and certainly on behalf of myself, offer my sincere condolences to the family of Dr. Dianti. I think it was a big shock to all of us. She has been a long time serving member of this portfolio committee. She was very dedicated, and I think it was a very, very sad loss, and I think it hit all of us quite hard. Also, my condolences to our chairperson, who we know lost his brother recently as a result of COVID. And I think we are at the stage now where each and every one of us, if it's not family of ours, somebody close to us, have been affected by COVID and have lost people. So we uplift all of those people in our prayers, as well as the country as we are going through this torrid time with this pandemic. Yes, we're at the start of the new year, and while one wants to say Happy New Year, it doesn't feel so good when we get a report of almost 22,000 cases, new cases being reported on yesterday, which is hugely disturbing and doesn't make for great feelings. I want to deal with some issues specifically. First of all, the letter that we received from the Honourable Frolick from the Speaker's office with regards to the fact that there will not be a special sitting to discuss this issue. I still believe that that is necessary, and that this must come back to the Portfolio Committee. Well, we have been asking for a meeting with the Portfolio Committee for over 2 weeks. We have been desperately disturbed about the situation. We have not been given access to information unless that comes via the media, which is not always reliable. We have not been given access to continual information. And there has been a call for unity. Well, we cannot have a unity if we are not all participating, if we are not all on the same page. The first outbreak of COVID, there was regular meetings with all the parties with regards to the situation, what was happening, what was being done, what was necessary, and everyone was given an opportunity to participate. That has stopped, and I don't know why. We must understand that no information leads to misinformation and fake news, and this is what we're having to deal with at the moment. Now, we are members of this Portfolio Committee. We are there to hold the department and the ministers to account. We are elected officials representing the people of this country. And they are coming to us for answers. They are coming to us for clarity. They are coming to us to find out whether news is fake or whether it's not. And it's very, very frustrating for us who are supposed to be holding people to account and who are elected by people and find ourselves in a position where we're totally unable to respond or we're not sure ourselves. It does not create a good impression, and not on this Portfolio Committee, not on the ministry or us as the elected officials. And it really makes me very angry that it's only when we get a letter from the Speaker saying that this must be taken up by the Portfolio Committee that we actually get a meeting held when we've been asking for this meeting for weeks. I think it showed a lot of disrespect to us, and it's been unacceptable. I want to deal particularly today also, I am a member of the National EMFs group, the Emergency Services group, which is both the fire brigades and all the ambulance teams. We today are advised by the EMS groups that 50% of their calls at the moment are all COVID related. Now, we sit with the situation, and I have just been down to the Peloso Hospital here, the Netcare Hospital here in Polokwane this morning. There is a queue of 29 ambulances waiting to get access into that hospital. Some of them have been sitting there for 2 to 3 hours already. Now, when we have all of our ambulances sitting outside hospitals, waiting to get patients who are very ill in those ambulances and who are requiring life support, and we can't get them into the hospitals, those ambulances are unable to go out on other calls and to help and rescue and support other people. This has become a huge crisis. They are also reporting running out of oxygen. So our EMS system is severely under strain. Outside our Mediclinic and the Peloso Netcare Hospital, tents have been erected. Now, the public in and around places like Limpopo, and it's not just in Polokwane that we're seeing this the country over. We are even receiving videos of ambulances arriving at underground garages at hospitals, and beds have been set up to admit people there. And then we hear from the provinces that there's no crisis. There is a crisis. There is a crisis. Dr. Jacobs talked now about deaths. Yes, the deaths are astronomically high. But there are people who are dying who shouldn't be dying. And I'm not talking about COVID. I'm talking about people, stroke victims, heart attack victims, people who've got serious ailments, who are being taken to hospitals, who cannot be admitted, who are being referred to another hospital 200-300 kilometers away and dying en route because they couldn't be admitted into a hospital under emergency circumstances. That is just, it's unacceptable. It's unacceptable. These are issues that really need to be dealt with. Now, I'm not sure about other members of the committee, but I know that several of us have been trying to get hold of the Medical Research Council, the Minister's Office, the Deputy Minister's Office, SAPRA, all of these entities that fall under our department to get information. We cannot get hold of anybody. Not the Minister's Office, not SAPRA, not the Research Council, nobody. Nobody has been available to us to give us information and to correct the fake news that we've got. Now, of course, there is going to be panic because the panic is created by the lack of information, and it's very concerning. And then finally, Minister, if you could give us some clarity now on what is happening at the border posts. The border post, and we've received videos of what is happening at Bike Bridge, and while my heart aches for those poor Zimbabweans who are trying to escape the torrid situation in their own country, we're receiving videos of thousands. Literally thousands of people trying to get back into South Africa, a lot of them not wearing masks, who are climbing over fences, climbing over each other to get into the country. That's an issue straight away, because what are we doing at those border posts to test these people? But secondly, there are border posts like Bike Bridge and Eswatini and Mozambique where people come in regularly on business and to get children to and from schools. Now, initially, the time, they were allowed to get a 14-day, they were tested that was valid for 14 days so that they could come and go quite regularly to get children to school, to get children back from schools. And now the new regulation is only 72 hours. This has caused a backlog of up to 15 kilometers of people waiting to get children back to schools, universities, colleges, and things that are open. And while that is happening, all of these thousands of people are milling around and infecting each other all over again prior to their entrance into this country. Can we please get some clarity on that? And I know that and obviously we want to know on the update of the oxygen supplies in this country, because oxygen, particularly from the EMS groups, are advising us all the time that there is a shortage of oxygen. Is there or is there not? I know that my colleagues have a lot of other questions, so I will leave it there. Thank you, Chairperson.
Good morning, colleagues. Thank you very much, Minister, for the presentation. I'm going to run through my 4 key questions quite quickly. I think my colleagues have covered the other matters that the chairperson had spoken about earlier. I just think before I get started, I just think it's very important to get this view out of the way, that we've had this conversation about the role of Parliament during a crisis or the role of Parliament during a pandemic. We had this whole conversation at the beginning of the year when we were first dealing with the pandemic. And it's very important to then, make this call again, that Parliament is not simply just the annoying stakeholder that has to often, be onboarded after the fact. It is a partner in this process, and it needs to be treated as such. And so I think I would make the call, and I would make the call, chairperson, that we actually have to formalize the updating of this portfolio committee on a regular basis. We've got to formalize it, whether it is once a week or once every 2 weeks. The reality is that we cannot be following the updates of what is going on, whether it's about vaccines or about infections or fatalities or some of the problems that we are seeing across the country. We cannot simply be following those from television stations without understanding exactly where this is coming from and getting the relevant questions. And so this is not something that is necessarily directed at the Minister of Health, because he reports to the portfolio committee. And so I think this is something that is directed to my colleagues, that this is a very important role for us, and we've got to take it seriously. We are not just a bystander in this crisis, but we're an actor on behalf of the people of South Africa. And if we don't take that seriously, then it's an indictment on all of us as members who are elected to serve. Then, Minister, I've got critical questions that I would like to pose at you. By your own admission, you have stated that South Africa was gun-shy of starting bilateral negotiations with vaccine manufacturers, and that, in fact, you most certainly almost relied solely on the COVAX facility for a long time, while other countries across the world were already starting to make negotiations with vaccine manufacturers, and we hadn't started that process because of the risk that you had outlined. And so, again, like I said, it's clear that South Africa was reluctant to get started on this. And often people say the reality is that it was financial problems or whatever the case may be. Now, I want to know 2 things. One, when did the bilateral engagement start? But not just broadly speaking, Minister, because every single time you are pressed on specifics about these bilateral engagements, you often refer to saying, these are sensitive negotiations, we've signed NDAs, we can't actually really divulge some of this information. And now this is, to your own admission, also fueling the kind of anxiety that we're seeing across the country, because we've got a situation where the COVAX facility can only deliver in the second quarter of the year. And you are hopeful that you'll be able to secure some kind of vaccine for our frontline workers by February, but you aren't able to divulge some kind of concrete timelines, or at the very least when those negotiations started. And when are we talking? Well, are we already at a stage where we're talking acquisition? Are we already at the stage where we're talking, the procurement of a vaccine? It's unclear, because you've got 5 or 9 of these manufacturers, and it's still unclear where you are. Have you dwindled it down? Have you taken out the manufacturers that are not suitable for South Africa? Have you looked at whether or not some of them are not even worthy of looking into? Have you also looked at whether some of them are prepared to do business with us? It's simply not good enough, sir, for us to accept that these are sensitive negotiations and we will come back to you when the time is right. We need some kind of determination of where we are. The second thing is, the money is often mentioned as a hindrance to some of these vaccines. We saw or the vaccine acquisition. We saw last week reports surfacing that there were, the South African government has said some of the vaccines that are on offer on the market are simply unaffordable to us. Now, again, if we are not having proper conversations about what else is on offer, when can those be delivered, we can't make an objective decision on whether or not some of these options are way too expensive. But more critically, sir, the problem here is that also, surely South Africa's entire priority should be targeting at ensuring that we acquire a vaccine so that we may be able to get back to some semblance of normality, so we can save lives and we can save livelihoods. It makes no sense to me how the South African government can in any way be considering any kind of priorities like bailing out failing state-owned enterprises when we can be redirecting billions of public money into this purpose. And so it almost feels to me that this is one of those moments where it is a life or death situation, and we cannot be talking about what's affordable and what's not affordable when there are superfluous priorities that the South African government has. So if you can just make mention of that process and why certain ones have been negated and why certain ones have been entertained. Then I want to ask, just before I close, the issue around central procurement. Again, what is the wisdom around having a system of central procurement when the process can end up being sluggish, the process can end up being slow, and we will not be opening up ways for other people to get involved in the process so that we can be able to roll out the vaccine as quickly as possible. In some instances, what other countries have done is they've allowed for various negotiations, but at the same time, or if, for instance, the private sector or various provinces have decided to not only be bound by the central procurement, what then you can say is that here's a priority list which has been agreed to by the World Health Organization, which says these are the top priorities. That way you are able to target people as quickly as possible across the country, because the task of 40 million people, when our only experience of mass vaccination has been 1 million people, is an audacious one. And now what we are expecting is government to be able to handle central procurement and the distribution of vaccinations purely by itself for 40 million people within a space of 12 months. It almost seems impractical to me, which links me to my last question. COVAX has made it clear that there are two main issues that they will consider when it comes to giving out of vaccines to countries. The other one is regulatory approval, which you've stated that SAPRA is on board and ready to expedite the issue. But also country readiness. That then means that there is now obviously an incredibly important task at hand of ensuring that the task that we have at hand of 40 million people to be vaccinated by the end of the year, we are able to deliver against that. But there's other issues of logistics around transportation, around storage, around distribution and allocation of the vaccine. And so that is why we've been repeatedly calling for a comprehensive plan that is codified, that can be shared publicly, that says, this is the South African plan for the vaccine, this is how we intend on rolling it out. Because surely if you have to submit that to COVAX, you can also make that public to the South Africans. And so that's it from my side. Thank you.
Good morning, everybody. I just have a few questions. Firstly, thank you for the presentation. My first question is on the issue of the various views on ivermectin. So I read a report recently where the World Health Organization sponsored a preliminary review indicating ivermectin effectiveness. So the report specified that the trials indicated 83% reduction in COVID mortality. Now, we've been told that, SAPRA has done all the, investigations and so forth, and they are refusing ivermectin. From my side, I would just like to know, has SAPRA done enough? If the World Health Organization has provided a preliminary review, why is SAPRA not taking this into account? Secondly, is that has the department done any comparison in cost factors with regard to, getting the vaccine? I'm talking about European countries as well as developing countries. It's not really specified on your presentation. The other point is a follow-up of what, the previous speaker spoke about with regard to central procurement. Now we know that Discovery is the country's largest private medical scheme. and has reportedly secured and ring-fence funding for the vaccinations of 2 million of its members. However, it cannot choose to purchase suitable vaccines because government will not allow this. Please, Minister, can you explain the reasoning why does government want to be the sole purchaser of this vaccine, considering the fact that, we need to have all hands on deck in assisting in getting this vaccine out to the people? And why don't we use these schemes, these medical aid schemes that can really assist government in locating this vaccine? The other point that I want you to know is that will the vaccinations in the long run be mandatory? And, just the reasoning behind it. I know the minister said right now that there are still, thoughts and discussions around it, but I would just like to know more about it. The issue of shortage of doctors, which we are having throughout, whether the COVID virus or not. But reality is that right now our hospitals and our health facilities are short-staffed. Can we get a guideline from the minister if all our interns have been placed? I know last year when we asked the question, we were told that by January, all our interns would be placed, and I just would like to know if that has been done. Minister, the issue of children under 18 years of age. I see your presentation specifies 18 years and over, but I'm just asking the question relative to critically ill children that may be, needing this vaccine quicker rather than later. Will they be prioritized? The last question of mine, Minister, is that we've already had reports of corruption when it comes to, or allegations of corruption when it comes to the allocation of funds in Gauteng, to our hospitals. I wanted to just know that, can you give us a full report, actually maybe on all provinces, whether we can get a full report on, whether we have enough beds, staff, equipment, and oxygen, considering the upsurge of COVID cases. Thank you.
Thank you, Honourable Chairperson. Good morning to the Honourable Minister, the Honourable Members. It's good to see the new year. Let's pray that God will protect us during this coming year and during this whole pandemic. From the side of the Freedom Front Plus, our condolences to the family of our colleague who passed away over the festive season, and also to the Chairperson for family member lost due to COVID-19. May God protect us all. Honourable Chairperson, Minister, please bear with me because I have a lot of points that I want to raise and to need to be discussed today. The Portfolio Committee on Health, Honourable Chairperson, Minister, and Honourable Members must be involved in decisions taken by the Minister before it's been taken to the Command Council. We as a committee must hold the Minister accountable to any actions or decisions that the Minister is making. We need to hold the Minister accountable and responsible for actions taken on. Now, the Freedom Front Plus is concerned about the possible chaos that, according to media reports, may ensue in the medical sector regarding South Africa's plans to vaccinate against the virus. Now, it seems like a trust gap seems to be building between the government and several of the country's best-known experts in disease management. And in an open letter to government by these experts, which was published in the media yesterday, comes very close to saying that government is first of all lying about any plans or strategy to vaccinate South Africans against the virus. And secondly, they say a cover-up is underway to cover up a breach of duty that could cost thousands of lives. This was reported in the media yesterday. Now, this letter was signed by Dr. Dessou, Professor Ray, Professor Richards, Professor Mendelson, Dr. Abdullah, Professor Vetter, Professor McIntyre, Dr. Wilson, and Professor van der Neeven. Now, this is the last thing South Africa needs at this stage, and it must be avoided at all costs for the sake of saving human lives and South Africa's future in general. At present, there are serious gaps in communication from the ministry side, and this committee must be consulted before taking drastic decisions. Doing so will ensure that the correct information regarding the procurement of a vaccine against COVID-19 and the current state of affairs in hospitals and healthcare workers in the country will be conveyed to Africans. Now, at this stage, there are too many rumors about what mentioned, which is mentioned, issues doing the rounds on social platforms and is causing panic among South Africans. And the only way to remedy this is to clearly communicate the correct first-hand information. Now, this committee must be kept up to date about the current state of affairs at all times so that we as members of parliament can effectively fulfill our oversight role, but at the moment we are in the dark regarding various aspects. And that's why we as certain members of this committee have asked numerous times this past week for this meeting today to be scheduled. And I'm glad that this meeting is happening today. Honourable Minister, we need to report on the number of patients that is currently in intensive care and high care in state and private hospitals throughout the country. The last report we received on this matter was, I think, in May 2020. We also report on the current situation regarding oxygen availability in state and private hospitals, as well as a report on personal protective equipment for doctors, nurses, and healthcare workers in hospitals. We are now in a second wave of the pandemic. We need to be updated regularly with such reports. Honourable Minister, I want you please to explain why South African state hospitals is still not ready for second wave, despite day 287 of lockdowns with regulations still in place which don't make sense at all. And if you want later on, I can give you some examples where I say the regulation is not making sense at all. Honourable Minister, please explain to us the placement problems with interns and how it will be urgently resolved so that these interns can help with COVID patients in our hospitals. I also want to know from the Honourable Minister, when will the Minister call upon retired physicians to come and help current doctors and nurses against COVID-19, as he has gazetted in Gazette number 43533 on 17 July 2020 under Regulation 79641. There are questions around the variant of the virus as well. Some scientists say the vaccine will not help against the new variant, and others say it will. Can the Honourable Minister please update us who is now correct and who is not, and what is correct and what is not correct? At this stage, there is little confidence in a vaccine program as reported in News 24 yesterday. And under the heading said a cancelled meeting delays and secrecy inside South Africa efforts to procure COVID-19 vaccine doses. Now, I just want to quote you a few. It says, documents seen by News 24 and interviews with several leading scientific experts and industry insiders confirm criticism that South Africa delayed in initiating discussions with pharmaceutical companies over COVID-19 vaccines. Health Department officials cancelled at least one meeting with one company that had reached out to the government weeks before. The Deputy Director General for Health, Dr. Alban Pillay, confirmed bilateral discussions with started in September, months after many countries had already concluded deals on this matter. And just Health Minister Zweli Mkhize on Sunday denied there had been an undue delay in securing bilateral agreements with pharmaceutical companies during a press briefing in which he provided details of the country's vaccine rollout strategy. And in an interview with Cape Talk on Monday, Pillay, who was part of the briefing on Sunday, said bilateral discussions had started in September and he hoped to finalize agreements early this month. The department was asked to confirm the exact dates of the first meetings with pharmaceutical companies, but didn't respond. Can the Honourable Minister please confirm to us today in this committee, to us as members of this committee, the exact dates of the first meetings with pharmaceutical companies and why department officials cancelled the one meeting with the one company but had reached out to the government? Why must the government be the sole purchaser also of the vaccines? I mean, and you can understand this, but there was so much corruption during COVID-19 last year, the public cannot trust the government, and how will the minister ensure that money raised or paid for vaccines by the private sector and paid out to the government, as you will be the sole purchaser, will not be stolen by corrupt official politicians? What guarantee can the minister give South Africans today that this will not happen? I almost finished, Honourable. The minister, with due respect, must stop taking action against countries that acted in time to obtain the vaccine. Stop complaining in the media that other countries must not have vaccines for themselves as that they must share vaccines with South Africa. The fact of the matter is that while this government were wasting by making useless and senseless regulations during lockdown level 5, and instead of getting the health sector ready for this pandemic, the rest of the world jumped in with full force to get the vaccine ready for their citizens. The rest of the world did not waste any time, but this government did. Precious time and money were lost and stolen due to COVID corruption that could have been used to pay for the vaccine. Now, Professor Marty said that the government's plan to vaccinate 40 million people by the end of 2021 will not happen. According to Professor Marty, the plan is nothing more than wishful thinking. Now, may I remind you that Professor Marty is a scientist, and according to him, even if government at the end of April with vaccinations will have to vaccinate around 150,000 people, and your numbers today indicate this morning a huge number of 360,000 people per day for 7 days a week for the rest of the year to reach 40 million people. Now, if COVID-19 tests could not be done since March 2020 to all 60 million South Africans, according to your report of last night, only 7 tests have been conducted so far. So, Honourable Minister, how are this government planning to vaccinate 40 million people at the end of this year? And can the Minister please explain it to us? Now, the Institute of Race Relations are on their way to court if the Minister does not answer questions on how the Minister is to distribute vaccine. I think it is important not only for the IRR, but also for the sake of all South Africans to know exactly when South Africa will receive a vaccine, how it will be distributed, and who will receive this vaccine. And can the Honourable Minister please answer these questions today? The Minister must also explain to us the current situation regarding field hospitals, and I have warned last year that these hospitals, the few that existed at that time, must not be but rather being kept for a second or third wave. Now it was being demolished, most of them. Now the question is, how much will it cost to erect these hospitals again, and why was it demolished in the first place? Thank you very much, Honourable Chairperson, and thank you very much, Honourable Minister. I'm waiting your answers. Thank you very much.
Thank you, Chairperson of the Portfolio Committee. Thank you to the Minister of Health for the presentation. First, I'd like to send my sincerest condolences to the family, and may all of you be deeply comforted during this hard time. Firstly, Minister, some of the reasons sent the letter is because there are some questions you cannot account, which I will state following as I'm speaking. For instance, how much money do we have? Seems how much money we need to ensure that the target that you have set.
Sorry, Chair, we can't hear the Honourable Chirwa.
Is reached. And thirdly, where will the money come from? I'm asking this question because so far, even the deposit, which was...
Honourable Chirwa, hello, Honourable Chirwa, I was thinking it's only my line that is got a challenge with the connection. Even though I requested that we show the video and the voice, maybe we will err on the side of just showing your voice, getting your voice, and maybe switch off the camera now because we do not get you.
Actually paid late. Came from the Solidarity Fund. Focal point because it then highlights the fact that government has been. Yes, Chairman. Yes, Chairman.
I was saying, because we are experiencing a challenge with your input.
I believe I'm more audible now.
Excellent. We appreciate that. Thank you.
Okay, just to fill you in on what I said before, my question is that since the Minister of Finance has not attended this meeting, it is then primary to ask the Portfolio Committee to ensure that we have a meeting with the Minister of Finance as well, because some of these questions cannot be answered by the Minister of Health in his capacity, especially because we have come to learn that the primary fundamental issue in securing a vaccine for South Africans, for this country, is the issue of money and is monetary based. Over 33 countries around the world have already secured vaccines for their citizens. And South Africa, being amongst the top 15 of countries with the most infections, has not secured a vaccine for their citizens and been rolled out as of December. Now, Minister, if there is no specific vaccine that has been identified by the department, as you state that it has not been identified, how then are we already allocated a vaccine in February? How then, on what basis are we creating a rollout strategy if it is not clear which vaccine we're already getting, and if we have not identified a vaccine as yet? And from whom or which manufacturer have we been allocated a vaccine for February already, which is next month? In a few days, this vaccine is supposed to roll out. How then is this going to be the case if we have not identified a vaccine that will be running, rolling out in the country as of February? And secondly, what then becomes the role of provinces in distribution of vaccines? I'm asking this because the issue of information is one that is recurring and is becoming a trend, really. For instance, the deaths that are recorded for Eastern Cape that has been mentioned last night, there was a note that states that some of them was a reconciliation from May and November. This is in 2020. So the issue of information and accuracy of information comes up once again, even though we had asked this as a committee as soon as February in the year 2020. And then this, we were affirmed and confirmed by the minister that the information that is brought out to the public is accurate. And yet in the year 2021, we learned that there is still a backlog of reconciling in the Eastern Cape. So even with regards to in the kind of loss that, how do we reconcile the backlog we have in certain provinces and our strategy in rolling out the vaccination? Because it means we do not have a clear picture if there is still a backlog to date on deaths that have happened, on infections that have happened, and recoveries that are happening. And thirdly, there is an insistence to pressure the public and citizens on what seems to be the problem of government. We can't consistently preach the message of sanitize, mask, and even if we do, government must shy away from insinuating that that is the primary objective of the state. Your objective as a minister, your objective as the president, as President Cyril Ramaphosa and the Minister of Finance, is to ensure that we have a vaccine. You have not done that, which means even though the majority of South Africans are adhering to their side of their obligations, you as a state, as a government, are not pulling up your socks and ensuring that your duty is done efficiently and sufficiently, because even namhlanje, we have an issue of accountability. The Department of Health nationally is regressing. The AG confirmed this quite a numerous times, and we've raised this quite a numerous times. There's a consistent regression in the National Department of Health. Who then accounts for that? You come in and out and give us information on ventilators and beds, and even inform the Council for COVID-19 that they can lower the restrictions and the lockdown regulations because health facilities are ready, only to find that health facilities were never ready to begin with. Who then takes accountability for that, for the infrastructure, for the healthcare workers' safety? The issue of danger pay and overtime pay is also an issue that should be collaboratively responded to by you and the Minister of Finance as part of the executive. The minister must not tell us about the Solidarity Fund. The country cannot run on charitable aspirations. We need the state government, the Minister of Finance, collaboratively with the Minister of Health, to tell us exactly what is the situation in regards to money. You have not secured vaccines because you don't have money. The money was looted, the money was misappropriated, and today we have a situation where the country, the top 15 of countries in the world with highest infections, does not have money for a vaccine. And the government must take proper accountability in this fact, because you are coming against people's rights to health care, which is a primary right for each and every South African in this country and people living in this country. We have a right to health care. And the fact that you have not delivered a vaccine, the fact that you have regressed the National Department of Health, means that you as a government have come against our primary right to health care. And to date, nobody has taken accountability for the fact that the state is directly responsible for the fact that we don't have quality access to health care. So can the minister also respond to that in the fact that how does the National Department of Health, how does the executive, how does the Minister of Health and the National Department of Health take accountability for their failures and regression, especially in relation to the pandemic, because now we are sitting as a country not having a vaccine because we have failed.
Mama, Honorable, is it Tigeledi Shabalala, please switch off your mic.
All right, it's an important issue, so that's why we're spending and dedicating a lot of time of the program towards the Portfolio Committee on Health receiving this briefing from the Minister of Health and on the status of healthcare services in the provinces in relation to the COVID-19 pandemic. The Minister also briefing the committee on the latest developments, including the rollout strategy of the COVID-19 vaccine. Also, breaking news on your screen, as you can see, happening on our watch. U.S. Congress certifies Joe Biden's win. What does this mean? Well, it means that Biden is now cleared to be sworn in as the U.S. president. This will take place in under 2 weeks' time on January the 20th. Reportedly, Vice President Mike Pence declared that Congress had confirmed the Electoral College tally of states' results that showed Biden the winner of the November 3rd contest against incumbent President Donald Trump. So we will bring you that soundbite of the Vice President declaring that little later on. We're also going to keep a close eye on this Portfolio Committee meeting as well. We'll bring you the biggest takeaways a little later on as well. I want to take you now to a virtual media briefing from the ANC. It's ahead of the Special National Executive Committee meeting outlining the programs and activities leading up to the 109th anniversary of the ANC. Let's take you there now live.
Tomorrow, Friday the 8th of January 2021.
Make a concise contribution in the light that some of us have already made, the 6 of them. So, honorable members, the following will then be speaking. Number 1 in this group is Honorable Sukers, followed by Honorable Dr. Tembekwayo. The third will be Honorable Kela. Number 4, Honorable Imam Sheikh. Number 5, Honorable Mama Shengwa. And then 6 will be Honorable Sokacha. While the honorable members are preparing, let me just mention this, taking it from Honorable Kwahube. I am actually going to maybe comment on your, I think, very strong suggestion with regards to regularizing our meeting with the minister. But that is assisting me to maybe make a correction here on what Honorable Wilson said. This meeting is not called because we were actually asked by the speaker to call the meeting. You are correct. We started the process of getting this meeting in place. I did not leave it to the staff members that I work with together with the staff of the minister. I personally was phoning the minister in this regard. And we were trying to get a date for that process while the minister is also traveling the whole country to do that. And when we were almost getting there, firstly, you then have to write a letter. The parliament is in recess. You have to mobilize your staff to be available, write to the House chair, request a meeting, wait and get a response. While that was actually almost finalized last week, there was a bereavement in my family. It was not easy to deal with this matter while my brother's wife was buried yesterday and he was in hospital, and I had to deal with that and deal with those issues. So the earliest I could get this meeting on was today, this morning, after the funeral we had yesterday. So I think we should actually be saying the 2 weeks delay was not because we were not aware of the pressures that we must get together as a portfolio committee, but maybe the concrete suggestion made by Kwahube, I may comment on it as we close in terms of regularizing our meetings and updates with the minister. Let me start then, Honorable Sukars.
Thank you, Chair. I'm not sure how we would get through in 45 minutes through everything. There was a request made for the meeting to be extended. I just want to hear from the Chair if that is possible.
I'm not aware. I did not check that with the minister because he has other pressures beyond 12 o'clock.
In that case, I'll continue, Chair. Firstly, I want on behalf also extend and support the extension of condolences to the family of the late Dr. Jantjie by the Portfolio Committee on Health. Dr. Jantjie's humility and a respectful manner of engagement served as a huge encouragement for first-time MPs such as myself. Chair, we need to acknowledge that across this nation, people are in mourning. And it puts a greater responsibility on us as public representatives to do our duty. And it is for this reason that I want to support the call for more effective communication between the Portfolio Committee and more regular updates between the department, the minister, and the Portfolio Committee. We must also emphasize, I also want to emphasize, Chair, why the meeting was called for by many parties on the Portfolio Committee. The situation facing our people on the ground is the reason parties on this committee called for the meeting for over 2 weeks. It is the number of deaths in our communities and the situation in our hospitals that are putting immense pressure on health workers. It's therefore that we ask that MECs be present, especially of the hotspot areas, to give us an update on what is being done, especially because we are going in some provinces now towards the peak of infection. And so it is very important that we need to look at what we faced in our constituencies. We've had people dying, Chair, dying because ambulances couldn't get to them in time. As public representative, I personally drove COVID-infected patients to hospitals to try and save their lives. The situation is traumatic for us that just as a matter of our work, just sometimes come in contact with the cold face of this disease. How much more for the many nurses and doctors that are now needing to rotate oxygen machines with patients and needing to decide who will live and who will die. I want to emphasize, Chair, that is the reality for South Africans. The vaccination is months away at best. So the current situation on the ground is what we need to address and that we need clarity on as to how are we going to deal with the coming weeks to ensure that people do not die unnecessarily. We've experienced untimely and unnecessary deaths of many breadwinners and loved ones due to the systemic failures and the glaring gaps. And we owe it to South Africans to demand that the committee not only be updated, but also that we now be told how optimal treatment will be provided in the coming weeks and how support will be given to healthcare workers. I have a number of questions and I'm quickly going to run through it now. The first thing that I as a public representative struggled with was how to get sick people that lives in shacks to quarantine sites. That information we need, because there are people who are deteriorating at home because of a lack of ventilation. They are ill, they are sick, and they are moderately sick, but they become severe because of the circumstances that they live in. So we need the information on quarantine sites and how to get our people to quarantine sites. Secondly, Chair, there are two critical issues that are affecting deaths. The one is people do not know when, but people do not go to hospital in time. People are unable to monitor. They're not middle-class citizens who has an oximeter, who can check their oxygen levels and all of that. People do not know. They wait until they are in respiratory distress. Then they go to hospital, and by that time, they can't find an ambulance. And when they do get an ambulance, they get to hospital and they need to wait in queues. So a comprehensive community campaign needs to be started by the department. And I want to ask the minister urgently to please tell us what plans are in place for a comprehensive communication campaign that will ensure our communities are informed about COVID, the symptoms, and what to do to ensure early treatment. Because early treatment will mean fewer critical cases arrive in casualty. Secondly, in terms of home care, when patients are sent home after a COVID diagnosis, they don't know what to do. They don't have adequate information how to.
In the previous year, adapting to the conditions of the lockdown, providing service and support to communities where our structures are, working together with civil society in ensuring that there are better ways of cooperating and collaborating with government through their own localized programs. Friday's main January event will be preceded by a number of build-up activities later today. One has already alluded to the commemoration of the life and times of Comrade Slovo yesterday, and that later today, the 7th of January 2021, the NC Youth League will host the Peter Mokaba Memorial Lecture as part of celebrating the 62nd birthday of former Youth League President Comrade Peter Mokaba. The event will draw former ANC Youth League leaders who belong to Peter Mokaba's generation, as well as the current leaders of the Progressive Youth Alliance formations. Our Treasurer General of the NC, Comrade Paul Mashatile, will deliver the memorial lecture, having interacted with young people coming from different sectors. Furthermore, on this day today, on the 7th of January 2021, the NC Women's League will embark on Umanyano program, which they have already been involved in throughout the lockdown period, in a form of a Charlotte Maxeke intergenerational program. This year, 2021, marks 150 years since the birth of the ANC Women's League's founding president, Comrade Mayor Charlotte Maxeke. Therefore, this dialogue seeks to kickstart the year-long ANC Women's League's planned activities supported by the African National Congress to celebrate the life and legacy of Comrade Mayor Charlotte.
A variant of COVID-19. What studies are underway to determine it? How soon will they be completed? And what mechanisms are in place to ensure this research informs our choice of vaccine candidates? Lastly, it is important to note that there are moral and religious considerations for many South Africans when it comes to vaccines. Are vaccines going to be compulsory? And secondly, will the content of such vaccines be made public? Will the department source a vaccine that does not use aborted stem cells in any stage of its development? I have many more. I'll stand with that. Thank you, Chair.
Thank you, Chairperson. And
other fraternal parties, including invited guests and dignitaries joining in virtually. Multiple platforms have been created to allow the media and the public access to the proceedings. Details of these platforms will be shared with both the media and the public across our social media platforms, as it is normally done by DIP. This year, the logo of the 109th anniversary consists of a special insignia, the baobab tree. The oldest living baobab is estimated to be more than 3,000 years old. The baobab is renowned for its magical powers and symbolic value to many indigenous African people, as well as its functional usefulness. The age and utility of this tree suggest endurance, wisdom, endowment, and bounty. In the 109th anniversary celebration of the ANC, the tree symbolizes the sustained presence of the ANC in our lives and its ability to weather all manner of storms in pursuit of the liberation of all South Africans. As we grapple with the second wave of the pandemic, we remember the families whose loved ones have succumbed to COVID-19. Our hearts go out to them. Let us all show compassion and solidarity with those who are infected and to offer support to all families who have lost their loved ones.
And diabetic people, but to say there's a lot more different populations that may respond differently to the vaccine depending on their genetic and other factors. We just would like to have a list of all those that will be investigated, not only the three, especially when it comes to administration of the vaccines. The following one is in connection with negotiations with vaccine manufacturers. And I would like to say there are some advantages and disadvantages that have been mentioned on different vaccine manufacturers, like for an example, the Pfizer, where they say 2 doses and the effectiveness thereof and where it has to be stored. But amongst those vaccine manufacturers that have been discussed, there was mention made of Johnson & Johnson, whereby only a single dose is sufficient. And the advantage thereof is that it's much easier to administer and more cost effective. And then to ask the minister, how far are you with the negotiation with the Johnson & Johnson? And going further, to say that various universities in South Africa were engaged.
Regions, including branches, have got their own Facebook pages. They will also be given content to be able to post on those pages. So all of what we are confident that all of our structures and the general public, including the media, will be able to have unrestricted access to the proceedings tomorrow. We are in touch as well with faith-based formations. The pastors will also be participating on the proceedings, doing prayers as we are used to all the years. That will also be done virtually as well. So I'll open the floor for clarity. We're just a round of questions for clarity, seeking questions if there's any from members of the media. Please indicate the media house you come from. Are we having any questions from the media? I'm trying to check on the boards for hands if there are any. I see the SABC was making a request to members of the media to switch on their videos. So we don't have questions. I take it that we don't. That means we don't have questions from the media.
I have a question, Mr. Mabe. Good morning.
Yes.
This is
okay. Just indicate where you are. Ordinarily, I would have expected members of the media to use the raise your hands button on the side, so we know who's speaking. But in the absence of that, you can indicate who you are and where you come from, and come with your question.
This is Harola Marolero from UFM. Am I audible, Bule?
Yes, you are audible.
Yes, I hear there's a planned event that is being organized by the ANC Youth League. The question is, which youth league? Especially when you have a task team running the affairs of the youth in the ANC, and you also have a consent group out there protesting, demanding to be handed back the ANC Youth League. Exactly which structure will be organizing and hosting this event?
Okay, no, that's fine. Comrade Nomvola will clarify that, but the media shouldn't be confused. There is only one ANC Youth League National Youth Task Team. So we should not confuse members of the ANC. So it means that the formal official events of the ANC Youth League are arranged by that structure that was set up by the National Executive Committee, which is the ANC National Youth Task Team. So there should never be confusion. But the Comrade Nomvola can come in and amplify that afterwards. Are there any other questions?
Yes, I've raised my hand. Can you?
Yes. Gavin from ENCA. You can come in. You can ask your question.
This is for Jan de Lange.
Yeah, I can hear you, Gavin.
This is not Gavin.
Okay. No, there's a question, Sisnomvola, coming from Gavin Wettles or from ENCA. Did the NEC discuss any other issues besides the planning for the January 8th statement? Yes, you raised your hand as well.
Pule, my hand is up.
Yes. Is it up on the, because I'm taking hands on the platform. But you can come in because there was only Gavin on the platform.
Thank you, Pule Mawet. Samkela Masawe from the SABC. Yes, I'd raised my hand up on the platform there. Essentially, we'd like to go and ask on the issues of the points that were raised by former President Mbeki towards the end of the National Executive Committee meeting, where he essentially said that your statement is too long, it's too repetitive, that will be delivered by the President tomorrow evening at 7 o'clock. What are some of the points that will be removed from that particular statement, which are raised by former President Mbeki, such as the repetition of the ANC continuously speaking about renewal and the erosion and getting rid of corruption amongst its ranks? He raised issues of the proactive steps that you will be taking. Can you shed some light on some of the points that were made by the former president, and what will be those issues that will be omitted from the statement? Hence, he complained that it's too long and South Africans will lose paying attention to it, to the length of the statement. And lastly, on the issues surrounding the Secretary General, Mr. Mabe, did the National Executive Committee decide on when it will be receiving those particular reports by the Integrity Commission that recommended that the SG steps aside with immediate effect? We do know that through the discussion Paul Mashatile had, the Treasurer General with one of our colleagues, Jezreel Chauke, he did say that we may find a situation where either the President goes nowhere and the SG goes nowhere, and they both stay put in their positions. Thank you.
Okay, it's okay. No, that's fine. Samkelo asking, we'll respond to those questions. There was another hand before I read out the question from Tumaole Mohlaole.
Hi, Pule, Lizaga from News 24. Just to add on to Samkela's initial question on the former president, we also have heard that the former president did touch on vaccine and COVID-19. Can Umam Nomvula just elaborate on what the former president said and what was discussed about the vaccine in the NEC?
Okay. There's another question. Okay, do we have another question?
Jan de Lange from Report.
Yes.
Can I ask, I mean, the lack of questions may be a result of your choice for the spokesperson for this press conference. Now, Mvula Makonyana was in evidence before the Zondo Commission, in findings by the AG, the Auditor General. He's one of the most reprehensible